Hi guys, Prab here from ProPhysio Plus. Today we're going to be talking about ankle pain and why it is important for you to understand your ankle pain. So please like the video, subscribe to our channel and share with your friends. All right, let's jump on in.
Hey guys, it's Mike here. So a common question that we get in the clinic is what causes ankle pain without injury? So as we know, ankle pain is a very common occurrence amongst athletic and non-athletic individuals. It can be usually attributed to rolling of the ankle during sport on uneven ground. This can lead to a ligament sprain or in rare cases even a tear. However, there are also many causes of ankle pain without injury. The main causes being due to wear and tear. Conditions associated with this are different types of arthritis, such as gout, osteoarthritis and rheumatoid arthritis. Another common question we get in the clinic is, why has my ankle suddenly started hurting? So as we've previously mentioned, ankle pain can occur without the classic causes of ankle injuries. However, ankle pain can suddenly occur due to other factors, such as injured tendons or nerves, tendinopathy, infection, and even stress fractures. Another cause can be a subtle reason, such as a change in footwear or even level of activity. Sometimes the process of adaptation is a painful one, and it is important to have this assessed, as there can be also some underlying muscular imbalances that are contributing to your pain. So if you've been involved in a traumatic incident, whether on the field or at work, it is important to rule out the possibility of a fracture. The Ottawa ankle rules are known as a very reliable tool for this reason and are very quick to administer. So we have Prab here and we'll go over the landmarks that we need to look for when ruling out a fracture. So there's 4 things to look out for when we are ruling out fracture of the ankle. 2 easiest ones to remember are these 2 knuckles on either side of the ankle here. So about 6 centimeters above. If we are to feel pain around these 2 areas here, then an X-ray would be indicated. The other 2 points we're looking for, again on either side of the ankle. The first one being on the inner side around here. So you can just palpate around this area. And again, if it reproduces pain, then you should look out for an X-ray. And the last one is on the other side, which is the base of this point right around here. So around the little toe, just further down, that's the 4th point there. So those are the 4 points to look out for if you are to rule out any fracture. And the second thing to look out for, which is the easiest, is if you can weight bear for 4 steps right after the injury or on presentation to the ED, then you will not require an X-ray. However, if you are unable to weight bear, then an X-ray is indicated.
All right guys, so we're going to talk about some common questions that you might have in regards to ankle pain. So the first being, what is the fastest way to relieve ankle pain?
Yeah, so the most common ways to alleviate acute ankle pain is by taking anti-inflammatories and following the RISE principles, which involves resting, icing, compressing and elevating the ankle following injury. However, research is now moving towards a peace and love protocol, which you can refer to Leki's video for more information. Following injury, it is important to have your ankle assessment to rule out anything serious. For more sustainable results, an exercise or mobilization program prescribed by a physio can help improve function and reduce the chance of recurrence.
Awesome. So another question that comes up a lot is, what is ankle pain a symptom of?
Yeah, so as we've spoken about before, ankle pain can be a result of injury to the structures around the ankle, such as bones, ligaments, tendons, and in rarer cases, nerves or the vascular structures. All ankle pain can be a result of wear and tear over time within the joints. The most common cause of ankle pain is the lateral ligament sprain, which is due to a rolling of the ankle incident. Though it is important to have your ankle pain assessed to ensure you are receiving the most effective treatment for your own unique situation.
All right, so another very big question that a lot of older people might face as well is, what are the signs of arthritis in your ankles?
Yeah, so this is definitely a very common question that comes in at the clinic that we see. So there are a variety of signs and symptoms you should look out for, such as pain, swelling, loss of joint range of motion, and pain when weight bearing. Other signs to look out for is inflammation within the ankle joints, such as the big toe. You may experience this as a vague warmth, especially after you rest, such as when sitting or sleeping.
So another huge question is, why does the side of my ankle hurt?
So there are many injuries that can contribute to lateral ankle pain, some of which include tendinopathy, tendon subluxation, osteochondral injury, which is loose bones within the ankle joint, ankle impingement, sinus tarsi or cuboid syndrome, as well as bony stress injuries or fractures. Lateral ankle ligament sprains are the most common type of ankle injuries. They account for 85% of all ankle sprains. The ATFL, short for the anterior tibiofibular ligament, is the most frequently injured as it is the weakest. If not addressed properly, lateral ligament sprains can become recurrent issues, especially within the sporting population. Basketball players have the highest incidence with a recurrence rate greater than 70%. Therefore, it is important to treat ankle injuries immediately to ensure they don't become an ongoing issue for you.
So there you have it, guys. Mike has answered very, very well to all these common questions that you might have in regards to ankle pain. There you have it. We've laid out how you can get on top of your ankle pain. So please let us know how you went with it. Please like the video, subscribe to our channel, and share with your friends and family, and we'll talk to you again soon. Making healthy simple, ProPhysio Plus.